Recovery is possible, but recovery is much more likely with effective treatment. Treatment helps overcome the physical as well as the mental effects of substance use on the brain. One method of treatment does not suit all, nor are all substance use disorders the same. The availability of treatment is dependent on location and funding. Comprehensive treatment for active addiction must also address physical and mental health, social, vocational, and legal problems. No house can stand on one pillar. Effective treatment takes time and support from friends and family and trained professionals. In episode 2, we'll hear from experts and people in recovery who will walk us through the reality of treatment. I'm betting that this reality will be nothing like your perception. For decades, the criminal justice system was expected to resolve our community's substance use problems. But despite the best efforts of good people, this approach has not worked. If nothing changes, nothing changes. Now, let's discuss what treatment really looks like from experts who know.
Two times an official inpatient. When you have a very high use of drugs, you kind of get brain damaged, and you forget. It takes a while for your brain to start working correctly again. It really does. I would say, based on some other places I've been for longer periods of time, about 8 months to a year. I started having revelations like, wow, it's like layers, you keep going up. That your brain starting to function again, like you start to be able to think, wow, when I get out, I'm going to do this, thinking longer term, making more appropriate plans for your life instead of just the next 5 hours, And I think if you are in treatment for longer, it prevents you from the risk of returning to use during those times when you're not strong enough to, fight those feelings that you get, those dreams that you have, triggers that pop up, people that pop up. It's hard to face all of those things by yourself.
Rural areas where the jobs were going away at the same time, OxyContin became not just a way to numb pain and psychic pain and physical pain. It also became a way that people used to pay their bills. If they could get a doctor to write them a lot of Oxy because the pharma reps were telling them that it was safe to do so, they could take half and sell half and make thousands of dollars in a month. And when you've just lost your textile mill job or your furniture factory job or your coal mining job, it became a way of life for a lot of people in the way sort of moonshine did back in the old days. Yeah. So that surprised me. It surprised me it had been going on for almost 2 decades by the time I came on the scene. And it just surprised me how little progress we had made, and how so often these folks are just sort of left to fend for themselves because of the behaviors that they've created in their families, and a lot of pain, and a lot of incarceration instead of treatment, and just a lot of people being sort of dangled out there to figure it out on their own when literally their brains have been hijacked by this drug. And So you have like former high school honor roll students resorting to prostitution to buy drugs. And the young woman I wrote about in the book, Tess Henry, you know, she was sent out to Las Vegas for treatment, and then when she drops out, which most do, she ends up prostituting on the streets of Las Vegas, which is a little different than Roanoke, Virginia, and she's ultimately murdered on Christmas Eve, her body found at the bottom of a dumpster. And just like, if you would think, if any family would have the resources to deal with something like that. You know, she was the daughter of a surgeon and a hospital nurse. And so to me, that was just a statement of how this disease, you know, spares no one, and really how until we get our arms around the stigma and the fact that we're not offering treatment at the rate that we should be, we're not going to make much progress.
For the folks and I think most of us have know of someone or who's dealt with addiction. So I think in the community, you know, there is more awareness just because of our experience over these years. But for the ones who have that hard line of nope, you've made your choice and they need to be locked up, jail is not a good treatment program. I heard somebody say, yeah, I did 30 days and I learned some other stuff about how to break into houses. It makes criminals better criminals. It doesn't, you know, a few people get motivated to change, but I think more, you know, again, jail is not it's not a good treatment program.
That's kind of what we're trying to do in Surry County now. We're trying to rally. Let's rally around all these folks that are less fortunate than we are right now. Let's rally to let them know that we do love them. They are loved, and there is hope.
We're something called a local management entity and also a managed care organization. So sometimes you'll hear LME/MCO. But really in a nutshell, what that means is we're an insurance company. We're an insurance company for folks who have no insurance coverage and those with Medicaid. But here's a caveat. We also provide services for the whole community through our Access to Care line, as well as some other services that involve crises. So we're here to serve the entire community, but as far as the insurance that we cover, it's specifically earmarked for those, again, with Medicaid, as well as those without insurance coverage. So what does all that mean to folks? We don't provide counseling services or treatment. What we're here to do is we help people get to the care they need. We have a network of providers that do those services, and we connect folks to those. And then for that provider, what do we do for them? We make sure they get paid. Much like an insurance company would do if, say, you went to the dentist or your primary care doctor, or whatever that may look like. Those folks will look at your insurance card, then they will take down your information, and after they do their service with you, then they will bill that insurance. Now, a lot of times you may go to your doctor and then they say, oh, you need to go on to a specialist for other things, or maybe you need to have this test ran, but we need to get that authorized by your insurance company. We do the same thing for certain types of services. We get requests from our providers for folks to be able to get additional services, and so what we do is we take a look at that request, and then we work with that provider as well as what we often call member. You may have heard words like client in the past, but we work with our members to make sure that they get what they need and it's the most appropriate service. Now, I've said a lot about what Partners does in terms of treatment and how we pay providers, but a big portion of what we do too is in engaging the community, but we also engage those members that we work with through member engagement services. So that's a real fast overview of what Partners does, and I saved the best for last. We have a place called Access to Care. And this is a 24-hour a day, 7-day a week, 365-day a year call center staffed by credentialed folks who are trained in all the behavioral health services, whether that's, again, mental health, substance use, or intellectual and developmental disabilities. So as we think about our mental health, as we think about our physical health, they're not separate. If my mental health isn't well, my physical health isn't well. If my physical health isn't well, I've yet to meet anybody whose mental health is doing great. So they're all combined, because if I have a broken arm, we don't cut the arm off and put it in an isolate in a hospital somewhere and treat that arm. The body's still connected to me. So I think about people, and I think about myself as what I call whole people. We're not in segments. It's all put together. So again, that number I mentioned earlier, the 1-888-235-4673 number, think about that number as a personal maintenance number. If you need help maintaining something for yourself or someone you care for, pick up the phone, call them. Or you can visit our website at behavioralhealthmanagement.org. There's a lot of resources on there. We Google a lot of things these days. That's in our vernacular now. That's how we talk. Did you Google it? Well, you know, use this website, use this telephone number, because here's the thing. If I'm looking for answers, a lot of times I'll find the answer that I'm looking for. If I'm looking for good, I'll find good answers. If I'm looking for bad, I'll find bad answers. But this is a credible information source, so I would encourage you to use that.
Trying to get in a position where we figure out how to incorporate more of a treatment model and less of, and this is my goal, my vision, more of a treatment model and less of a punitive model. Because you know, those that are suffering an addiction, they feel bad enough as is for a lot of the things they go through. Sitting here, I'm thinking about one of the individuals that I used to work with. He said, when I'm not using, I will give you the shirt off my back, right? I will help you in any way that I can. But when I am using, I will kill you for your shirt, even if I don't need it. And he described it that way to show for him the polar, the opposite of how he is in addiction versus how he is sober, right? And so with treatment, we can get that person to more of that long-term quality. I'll give you my shirt time and time again, right? From a punitive standpoint, you know, we're not addressing the underlying issue. So detox is a really important starting point for someone. So in detox, it's typically a 5 to 7 day stay. And that's for someone who identifies that they are not able to withhold or withstand from drugs or alcohol on their own. They need to be in an inpatient setting with medication, nurses, doctors, the whole wraparound of guidance, of care, in order to get off of the drugs and alcohol. And so detox, as important as it is not treatment. It is the foundation and the stepping stone to help you get to the treatment. And the reason why I say it's not treatment is because during those days, you are foggy. You're not thinking clearly. Oftentimes, you're in the limbo stage of change. And that's what I refer to as someone who is hesitant or they haven't really made up their mind if they truly want to abstain from drugs or alcohol, right? And so during that time period, they're trying to figure out what they want to do in terms of treatment. Detox helps connect you with resources so that way you can get to the treatment once you discharge. But let me be clear, when I say detox is not treatment, I explain that you are typically there 5 to 7 days. you can't break a habit in 5 to 7 days. And so the habit or pattern of using drugs and alcohol has formed over the course of years. And so we can't expect someone that has engaged in that lifestyle of 10, 15, 20 years to just stop after 6 days. So one of the challenges I would say that someone often faces when they are ready to engage in treatment is the looming stress of, but I don't have insurance, right? Fortunately, there are agencies in the community such as RHA where you can come and receive the outpatient treatment, whether that's, again, just with the therapist a few times a week or more of that comprehensive every day, and you don't have to have insurance. And so if, the lack of having insurance, if that's what's stopping someone from entering treatment, I would strongly encourage them and urge them to walk through the door of RHA or another agency, again, that does not require insurance. So I cannot sit here and say that inpatient is better than outpatient or that outpatient is better than inpatient. What I will say is the effectiveness of whichever line of service that someone chooses to go with depends on their willingness and readiness to get better and depends on where they are at that time. Inpatient helps to take away the distractions of what's going on in the community. So what I mean by that is if someone is in an unsafe or unhealthy environment, going to an outpatient setting may be beneficial or effective, but they may have a hard time achieving that long-term recovery or sobriety because that environment is unhealthy, right? So inpatient can take them out of that unhealthy environment, help them regain new aspects about themselves, coping skills, and could possibly also explore helping someone get into a different environment or setting. Whereas outpatient is could be beneficial and helpful depending on someone's situation. Let's say they're employed and they don't want to go to inpatient and have to quit their job, or they have children or a loved one to take care of. And so again, I can't say that one is better than the other. It goes back to there's no one shoe fits all model. Whenever you come in and we do an evaluation, we look at what is best for you at this time. Whenever we have the label or the term alcoholism, or someone who uses heroin or crack cocaine or whatever the substance is, there's often a stigma associated with that. For that individual, that stigma internalizes as shame. And so if I'm shameful, I'm less likely to ask for help. I'm less likely to go to my local church or wherever my form of resource is, because I'm afraid of what someone is going to say about me, what they're going to think about me. There's also a certain behavior that's associated with individuals that use substances. And so I often tell people, just because someone is suffering from addiction does not mean they are a bad person, right? They are suffering and learning how to do things differently, but they're unfortunately, due to the addiction, engaging in bad behavior. That doesn't make you a bad person. And so I think it is really important, in order for us to combat our substance use crisis, is to normalize what someone is going through, right? And so that when you normalize, that means you treat someone with compassion and care. You do everything within your means to help someone get into treatment. You don't shame them for it. If someone makes a mistake, you support them through, okay, what could we have done different? But again, you don't shame them, because every time you shame me, I then close up in my shell, and I'm less likely the next time and the next time, or however many times after, to ask for help. And so as we normalize We then move into a phase, if you will, of instilling hope and sharing hope with someone. You know, if you have hope, that means that no matter what you have to do, no matter the hoops you have to go through, you are going to work as hard as you can because you know that there is something on the other end of that horizon. You won't go through that in the form of stigma, in the form of shame, but with hope, you will try to find a way to thrive and survive and get through. And so when I look at stigma and I look at hope, I'd rather have hope because I'll also have a better community. I'll have a healthier community. Stigma just sweeps it under the rug and puts something beautiful on top of it and act like it's not there. Doesn't mean that dirt isn't under the rug. It's going to continue to pile up, right? Hope cleans that up.
It's an integrated approach where we provide hope, grace, mercy, and forgiveness. And in order to obtain those types of things, we have to talk to one another. Those of us who can prescribe medications, those who can provide counseling and community support, those who can provide spiritual support and family support, all of us that provide those pieces of the treatment of addiction need to sit and talk to one another and say, these are our experiences and these are things that have been successful for us, and how do they parlay into your purview when it comes to this?
It is a tough one because it is ingrained in our psyche, into our national thought. And we believe that we can use law enforcement to get through this. We can just incarcerate all the people who are addicted and that'll take care of it. But it's not working. If incarceration, if it was able to make a dent, it would have. And yet politicians will continue to be reelected on, we are tough on crime. It's not working. We have to stop seeing it as a criminal issue and see it as a public health issue. We have to understand that treatment is the solution. Here's the road to recovery. And this is a rocky road and it's not a simple path, so we're going to walk it with you. And the people who have already walked it, in particular, we need them. They're the ones that can speak this better to the population, to be able to say, I've been there. I know what you're dealing with. But those people need our support too. The folks that are in recovery need to know that they have a community behind them that loves them and supports them and encourages them to stay sober. If we took all the money that we spend on incarcerating and jail and all the court system, redirect that into healing, I think we would see a huge impact in our community. Instead of building a new jail, why don't we build a new treatment facility? Why don't we support the people who are already here in our community doing this work? Why isn't that our priority? Jesus told us point blank, the two most important commandments are to love God and to love your neighbor. And I keep saying to the church, every decision we make, we should bounce it against those two criteria. Does it show that we love God? Does it show that we love our neighbor? Standing behind policies that said we're just going to arrest everybody and throw them in jail. Okay, are you not going to give them any relief while they're detoxing in jail? Are you not going to try to help them when they get out? Because you know there's that window when they get out, they've been clean for however long they've had to be in jail. Are they going to go back to their running buddies, or are they going to take a path towards recovery? We need to be there right then, saying to these folks, we love you, here's a path. Some of them are still not going to take it. There's some people that just won't listen. There are some that are bent on their own destruction. They need help too.
It's been my experience that people don't recover by themselves. and we've talked about this Surry and the road to recovery. Communities recover together. And people get better together, not alone. So I want us all to take just a minute to think about not only getting better, how do we stay better? Because the thing is there's so much good already here. There's so much positive already here. There's so much hope that we can already hang on to that's already here. Sometimes we don't see it, but those pockets are alive and they're well. But let's continue to tend to those things.
Treatment changes lives, restores health, and heals families. But it's hard work, and sometimes people just aren't ready. It may take more than one attempt, but treatment does work. Treatment methods impact each person differently. The more treatment opportunities available, the more impediments removed to effective treatment. The less stigma associated with treatment, the more community health and safety improves, the more families reunite. In episode 3 of Surry, The Road to Recovery, we'll focus on prevention. Prevention must start early with education so that our children understand the dangers of substance use and how it will rob them of their futures. The education of medical professionals, government officials, and the public is critical to understanding what each of us can do to prevent someone from traveling down the path of substance use disorder. So please join us in the next episode when we learn about prevention in Surry County.